actually, we can start. So thank you for being part of the Congress, for being here. It's a bit late here in Europe, so I'm not sure what time is it at your place right now. It has been a very interesting presentation from all of you. So first, I want to ask Professor Schwartz if he's with us. He was speaking about allergies and the most common allergens, like, let's say, peanuts. So I wanted to ask him what is his position, because in some low-income country where we still have disnutrition, some children use Plinky food, which is all based on peanut, and it also has there are some dermatosis connected with the malnutrition, like flanky pain, dermatosis, etc. So I wanted to ask Professor Schwartz what is his position about those allergens in a situation where the food supplements are going to be based on, let's say, peanuts or some other nuts that can give allergies.
Can you hear me?
Yes.
Oh, thank gosh. I was wondering. I want to thank you all for magnificent presentations, first of all. And Estonia is fantastic. Where are you, Albertine? France?
I'm in Spain.
España. Okay.
Yes, sí, España.
Okay.
Comunidad Valenciana, para ser exactos.
Valencia. I've only been to Valencia, Venezuela, but you'll forgive me. And of course, Professor Handler, we're grateful for your beautiful presentation too. Now, you were asking about, I was going to ask Professor Kono about ecthyma gangrenosum, but let me hold off on that for a moment. So the question is, what do we do with food? Well, the big thing now in America is healthy food. So much stuff is probably not in that category. Remember that it's not just peanuts. Peanuts are not nuts, as I said, they're legumes. And so there's a lot of cross reaction. It's not just peanut products. And some people are very allergic to them, which can be devastating, quite thankfully not so commonly. So what do we do about it? Well, gosh, we have to clean up the food environment. We need natural foods, not so many of these artificial foods, if they're foods. I think that's probably the best approach to look at that. We want to use natural foods, not a lot of these additives, these natural olive oil, not some of the other oils which are really not healthy. A whole new perspective, we hope, on pollution will be coming out of things now. I showed you a picture of my favorite restaurant in Warsaw, Bobby Burger, and with lettuce on it, not just a hamburger, but the lettuce. People worry about allergies to lettuce. I mean, and also, by the way, with the alpha-gal, it's not just the meat, it's meat products. So the whole spectrum's widened, and rather terrifyingly so. Okay, because ticks, we get tick bites from Central Europe. I'm not sure in Tallinn and Poland we have big tick bite. In Croatia we do, throughout Central Europe, and I guess Central Europe includes Estonia as well.
Yeah.
Right? Yeah. And you have a problem with ticks there too, like we have in Poland, and we have in the Northeast America. Yeah. So we have to. So it's a challenging topic, and again, healthy foods, I think, are the first thing to do if we can somehow avoid all those ultra-processed foods. They're not good for people, and I think that'll go a long way, I believe, in reducing not only allergies, but also perhaps diabetes, hypertension, etc. At least there's some evidence that may be the case, and I'm looking forward to exploring that nation worldwide. Professor Handler, any comment on that?
No, I think the movement we've seen with more healthful foods is very poignant, especially as we see we're focused on that around the world.
So I have questions for all of you. So the first one: what are the main diagnostic challenges related to food allergies impacting skin health? So I think it's more or less what you already. I think it's kind of nutritional education, maybe. Very important.
Yeah, I would say we've seen this new adoption of early introduction of allergens for infants, which is not the case, at least in the United States, hasn't been historically. We've usually been banning and running away from things, so that's been changed a lot as a shift in the paradigm of how we treat food allergens and children, and also trying to be more transparent in what ingredients are in processed foods and moving away from that. I think Dr. Schwartz was alluding to that, but Europe is vastly ahead of the United States on that. But the importance of awareness, especially amongst consumers, is becoming more apparent to me as I see people who are more aware and not just having very restrictive diets, but having targeted restrictions and awareness of chemicals that may be leading to skin reactions that they might be having.
Then, how have recent treatments for food allergies improved the management of dermatological manifestations? And are there significant regional or ethnic difference in the prevalence and presentations of food allergies?
There would have to be, because there are different diets. Our Polish diet is probably more, it's different probably than the Estonian diet and the wonderful food you have in España. I mean, and mi piace, no, mi gusta.
Me gusta.
Studio portugués y castellano y italiano y hablo lengua confusa. Okay.
Do you think that this increased because I have read some studies that connect allergies in generally with breastfeeding? So do you think that this all these allergens and allergies and atopic dermatitis and autoimmune can be related on the fact that there are always every day less and less and less women that breastfeed their children?
That's actually an excellent point. We had a professor from Warsaw as visiting professor for our honor society at our medical school, and she's it's a big deal in much of the world. Breast milk, and I think that going back to the way things historically have been is an asset. I'm not sure how many years you should breastfeed, and it's really perhaps, but Dr. Handler, yeah. Any comment?
We have now some questions for Professor from Alois Italo, but he's not connected with us, and also from Professor from Indonesia, but they are not here, so we're gonna send them by email the questions. And then I have questions for Professor Zach Handler. What are the main biological mechanisms through which air pollution impacts the skin? And are there specific populations or regions particularly vulnerable to effects of air pollution on the skin?
Universally, we've seen this throughout the world. Similarly, be it East Asia, Southeast Asia, United States, and South America. In my talk, I even talk about the high elevate. The increase in Africa, which has been seen with a lot of coal burning through the lungs. There is potential for allergens to start the immune reaction, but I don't have the specific mechanism off the top of my head for why.
Mm-hmm. And what prevention or intervention strategies do you recommend to mitigate the effects of pollution on the skin?
a lot of introduction of antioxidants in products. We're starting to finally see that used more, but a certain number of contract manufacturers are including like hydrocarbon receptor products, and that's going to really change a lot. And the use of antioxidants in sunscreen.
There is a question I wanted to ask you. We are studying at least, I have been for years studying the pharma contamination at the seawater. So we do know that certain topical corticoids increase the acidity of seawater, and that's one of the reasons why there are certain problems on coral reefs. So what do you think about pharma contamination, or we say the residuals once the people expose the medication out of their body and they stay for years in nature and in the environment? How do you think that can impact the skin and skin diseases?
That's a great point. I mean, I studied that also, not specific to that, but with the coral reefs down in the Florida Keys, and even, obviously Hawaii and Southern California. That was a really big topic several years ago. And a lot of the, sunscreen manufacturers were forced to and elected to reformulate entirely. But, we've seen these pollutants start to change the way the ecosystem of the ocean, like you said, affects plants, but how it's in animals and more than microplastics, which is certainly an issue that we are concerned about. But within the sea, on human contact with skin, I couldn't give you the reference off the top of my head. I think it's a really, really interesting point you just mentioned.
Okay. Then we have a point about vitamin D, but Professor Samira is not with us, so we are gonna send also to her and Bulos Pemphigot. Well, actually, there's some. I'm not sure if those are urban legends or there is some science behind it, but I have read in certain studies that there are some foods that actually can trigger the pemphigoid disease. So I'm not sure if Professor Schwartz can comment us something about it, since the Professor Pazzati is not with us, and he's here the expert about food and allergens.
Certainly, there are a number of identified foods that are presumably in medicines that presumably are risk for causing or enhancing risk. There's no question about that. How firm it is, again, is soft. But yeah, there certainly are a number of them. No question about that.
And now I have a question for Professor Pilecono. What are the primary applications of ultraviolet-induced fluorescence dermoscopy in clinical practice? Is this technique more effective for diagnosing specific dermatological conditions? And what are the limitations or challenges to make this technology widely accessible?
Yeah, it's very useful tool because it's very easy to use. And old time, we used Woods lamp, but then I also forgot my Woods lamp. But now this UV light is connected with our dermoscopy device, and as we are using dermoscopy every day and for every patient, it's very easily I'm detecting all my cases in practice, so that I'm using dermoscopy and then I'm switching to UV and I'm examining each patient with UV, and then I can discover surprises, especially into form of bacterial and fungal that flourish. It's sometimes even surprise that, yeah, I'm using a lot of.
I saw I saw also some great pictures in your presentations with tattoos and henna.
Yeah.
I like tattoos. So have you had a lot of cases of tattooed people, or maybe not even with small tattoos, but the ones that you know, that people that have the whole back tattooed or very big surfaces, that would be very difficult maybe to diagnose in a normal situation. Have you encountered cases where there were people with very big tattoos that you could not actually see the disease and the skin lesion, and you had to use this tool? Did you have a lot of cases?
Yeah, it's coming much more popular in everyday practice, and especially our young people and patients using that quite a lot. As we are comparing like this henna tattoo, and sometimes during vacations they are using like there might appear like contact allergic reaction to paraphenyl diamine. It's like a black color.
Mm-hmm.
But if like real tattoo, we notice that most serious is a red color. There are different reactions. Sometimes we even afraid that there might appear like sarcoidosis or different like skin reactions. But yes, red light for red color.
Mm. So
And of
and
course, yes, as we are detecting like early melanomas, that's our main target, like in everyday practice. And then, of course, it's very complicated if there are some pigmental lesions and they're like artificial tattoo pigment. But yes, dermoscopy sometimes helps, but of course, gold standard is biopsy and histological investigation.
and what about henna? Because I saw in your presentation that that henna sometimes can lead to a misdiagnose, maybe. And for example, during the cares in Africa, we saw a lot of women, especially, that they taint their nails with
Yeah,
henna.
yeah.
So sometimes can be very difficult to, maybe they have like pseudomonas or infection, or maybe it's a henna that has gone wrong or whatever. Have you ever encountered that in your
Yeah, in
practice?
Estonia, we our patients are not using henna so much, but if they are going to some holidays and vacations, especially in Egypt, they are very happy to make some decorations, and yes, sometimes there are even like photoallergic reactions because there are some artificial pigment plus UV uh, uh, together might give reactions.
Hmm. And
One
have you
thing,
ever encountered, because sometimes and that's something I have seen on people at the pool. There are a lot of teenagers that buy cosmetic products in some popular internet chains, etc.
Mhm,
And we all know that those cosmetic products are not always the best quality, and they can have some heavy metals inside,
mhm.
or some pollutants, or some colors that should not be inside of them. Have you ever encountered some kind of reaction on a cosmetic product that was not of good quality, or let's say, I don't want to say falsified cosmetic product, but not a good one, and that you couldn't diagnose it with normal light, but and you could diagnose it with ultraviolet?
That we noticed, of course, there has been some infections, or but due to nails, we have been noticed that, for example, gel lack and of course traumatization during this manicure procedure might cause much often nail psoriasis. And yeah, and as like nail psoriasis is sometimes early starts earlier than psoriatic arthritis, and it's like a trend.
Okay. So we have Leonardo joining us from Mexico. Hola, Leonardo. I am not sure if he has some questions.
I just want to say it was a very pleasure to hear you, Professor Pilcona. I see you have a very great experience. Also, Professor Robert Schwartz. So, in my experience, I saw too many patients who has a reaction, even when they made a tattoo with the red color.
Yeah.
Yeah,
Yeah,
one also of yellow color with the sun and the Swedish flags, and getting, of course, I think it's cadmium. Is that correct, Sheila?
Yeah.
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 It, it's very on the nails, as Albertina says. I saw many women who has candidiasis in the fingernails. It's very common too. Associated to jellish or something like that.
Yeah.
Thank you very much.
Thank you
Um,
for asking.
I also wanted to mention that well, both Leonardo and Professor Schwartz, they are member and directors of the Worldwide Dermatology Collaboration. It's a society that was formed last year, later by the end or half versus end of last year. So we also wanted to invite Professor Pilecono to join us if she wants, and we also want to invite everybody who is watching us right now to join as members or associated members. But I am sure that Professor Traore and Leonardo will send you an email about it. And Professor Robert Schwartz is one of the vice president. So I am the treasurer, and Leonardo also he's one of the founding members. So yes, and if Leonardo can tell us more about the upcoming series that is going to be about the Americas, since he's and Robert are both from the USA. So
Yeah, it could be a pleasure that you join us, Professor Pilcona. Your expertise is going to be very useful for us. And we're going to have our session academic for Americas. The main section, it's about tropical diseases. This is my expertise and other speakers that I invite. And I'm gonna send you an email with the link and the our web page to join to the WDC society.
You people, you are people with great passion, a lot of passion, and I appreciate it. I appreciate that you are doing so amazing work. Thank you.
thank you very much. I don't know if anybody else wants to say something. If not, it's
Well,
very late. It's almost 11 p.m. here in Spain. And thank you all for being here. And thank you again. And hope to see you soon again.
well, you let me say what is wonderful to have such a global, picture. We have the largest country in Africa represented, Algeria. We have, of course, the magnificent
Yes.
España.
Go.
Me gusta España. Me gusta Madrid. Me gusta Sevilla. Me gusta, well, I'm not sure if it's in Spain anymore, but Catalunya. Me gusta the Baltic.
We would actually be the last part of Catalonia if Catalonia would be independent, but it's not. So we are in Spain.
I didn't know that. I didn't know that, really, because I'm
Yeah.
trying to learn a little Catalan. We love Andorra. We cross the border into France, and they have only the Catalan flag and the European Union flag and the French flag. So you have a great nation either way you put it, right? We want to cover all the bases and be include everybody. So we're grateful. Obviously, we have a Baltic professor here, and the Baltic Durham Society is also under Anders Rubens, is also first rate and magnificent. And have you been to Riga? You go to those meetings too, Pila?
Yeah, we are communicating very often, and as Latvians are our very good neighbors.
Yes, Riga. Yeah.
We have very friendly communication with Latvian doctors.
Latvia, Lithuania. Of course, I'm Polish.
You as well. Yes.
From California, but my wife, of course, is from Akademia Medicina Warszawa, the Warsaw Medical School. Okay.
Professor Traore is telling me that a friend of yours, ZH, I think.
Zach Handler, Professor Zach Handler, yes.
Yeah, that he was supposed to join. I'm not sure if I understand it properly. So I think he's going to speak with you about it, because I'm not sure if it's somebody who's supposed to join.
Well, yeah,
or was supposed to join.
Zach Handler is has a major international focus. We lectured together in Kuwait. We lectured together in Jordan. He's traveled all around West Africa. Amazing, before he became a resident in my program. Dr. Handler is a major figure with incredible reach worldwide, right, Zach?
Right.
Oh yeah, he's here.
He's a global guy, and his wife also, by the way, is a famous pediatric dermatologist, rising star, along with Professor Handler. Zach, you speak for yourself.
You're going to make me blush now. Oh, that's too kind of you. Very, very kind of you.
This is a major figure in world dermatology, a rising star. I have to say, there's no question about that. And so hopefully we'll all get together, and perhaps even in person, although I don't know about these things. It's so easy to do it this way, isn't it? But there's nothing like being together in person, and we're grateful from Albertina, who now tells me, Zach, that she's both Catalan and Spanish. She's a Spanish Catalonian. She covers both bases, all bases, right?
Oh, speaks Catalan. Oh, very interesting. Okay.
I didn't know that. And of course, I love Tallinn. I've never been to your city, the university city. I've only been to Tallinn. So I've had a deprived childhood.
Welcome. Our university town is Tartu, is the south of Estonia, and but yes, you can visit Tallinn and Tartu as well.
Yeah, I've only been to Tallinn. I've only, had it, like I said, but everything. The world is so wonderful too, and I hope to go. I've been around Spain, but never your beautiful city. Valencia.
Well, I am I am 200 kilometers south of Valencia. So it's like we always have nice weather. Like today, it was 23 degrees.
Oh, great.
We have the same weather here.
Quite cold for us, but it's...
Sounds lovely. You're right. Here we have 23 degrees, but it's in Fahrenheit.
No, we have normally it never goes under 15. but we do have nice weather all year, and maybe we have 10 to 12 days of rain during the year. So yeah, it's very dry area and very hot, and it's a very, very high quality of life, to be honest.
It's cold in Estonia. It's winter time yet, and we had a lot of snow some days before, but now it's a little bit rainy and coming again warmer. But I'm missing the snow because I'm like skiing and winter sport as well.
Well, every part of the world has its own charm.
Yeah.
Some places have snow in winter, some other has hot weather and beach all year long. Anyway, thank you very much again for being all here. I am sure Professor Traore will contact and speak with you about the society. He is the president of the society at the end. So tomorrow is the last day of the Congress, and if you can join us and follow it, it will be awesome. Otherwise, we're gonna see each other in some next occasion. And the next Professor Schwartz, I'm sure I'm gonna see him for the America series with Leonardo, and hopefully I will see you in some other occasion soon.
Yeah. See you.
Thank you very much.
Bye.
Thank
Bye.
you.
Bye.
Thank you.
Bye. Bye. Thank you. Bye.
Hasta luego. Zach, you're still there?
Yeah.
Okay. So good show. It worked out well, and we'll talk more about. Well, I'll talk to you on the phone, I guess. Maybe that'd be more discreet than